Imagine this. You are in a foreign country. Your stomach is in pain. You walk into a hospital. A doctor comes to you and says, "We need to perform a minimally invasive laparoscopic procedure under general anesthesia as soon as possible." And all you can think is, what does that even mean? Today, we are going to make sure that never happens to you again.
Welcome back to Next Level English, everyone. I am Tom.
And I am Maya, and today's episode is one that could actually save your life, or at least save you from a very, very stressful situation abroad.
That is right. Today we are talking about English for clarifying complex medical procedures during stressful hospital visits abroad. This is real English. This is survival English, and it is the kind of English that most textbooks never teach you.
Tom, before we start, I want to ask you something. Have you ever been sick in another country?
Oh, yes. One time in Southeast Asia, I had a fever, a bad one, and I walked into a clinic and the nurse started explaining something about an IV drip and blood panels, and I just stood there nodding like I understood everything.
And did you understand?
Maybe 50%, and that 50% I was not sure about either. That's the problem. When we're stressed, when we're in pain, even confident English speakers lose vocabulary. So for our learners today, this episode is everything.
Absolutely. So let us jump right in. We're going to go through powerful chunks, key vocabulary, and very natural sentences that you can use inside a hospital when things get complicated. And the most important thing we want you to do today is repeat these out loud with us. Ready?
Let's start with the first and most important chunk you need in a hospital abroad. The chunk is, could you explain that in simpler terms, please? Say it with me. Could you explain that in simpler terms, please?
Could you explain that in simpler terms, please? This chunk is gold. You use it when a doctor or nurse says something you do not understand. Instead of nodding and pretending, you say, "Could you explain that in simpler terms, please?" Let's say it one more time together. Could you explain that in simpler terms, please?
Beautiful. Now, why does this chunk work so well? Because it's polite, it's direct, and it tells the doctor exactly what you need. You're not saying you don't understand English, you're saying the medical language is too complex, and that is perfectly reasonable. Even native English speakers say this to doctors.
Let me give you a real situation. The doctor says, "We are recommending a percutaneous coronary intervention," and you say, "Could you explain that in simpler terms, please?" And the doctor says, "Oh, we want to put a small tube into your artery to open a blockage." Now you understand. That is the power of that one chunk.
Now let's move to vocabulary. The first word is procedure. A procedure is any medical action that a doctor or nurse does to your body. It could be small, like taking blood, or it could be big, like surgery. The word is procedure. Say it. Procedure.
Procedure. And the sentence you need is, "Can you walk me through the procedure step by step?" Can you walk me through the procedure step by step? This sentence is powerful because you are asking the doctor to explain everything that will happen to you in order, from beginning to end. Can you walk me through the procedure step by step? Say it again. Can you walk me through the procedure step by step?
I love that sentence because it puts you in control. When you say walk me through, it means guide me, show me, take me along the path. It's a very natural English expression used in professional and medical situations. Walk me through it. Very useful.
Next vocabulary word, consent. Consent means giving your permission. In hospitals, you'll often hear the phrase informed consent. Informed consent means you understand the risks, the options, and the procedure, and you agree to it. The word is consent. Consent.
And the sentence for consent is, I would like to understand everything before I give my consent. I would like to understand everything before I give my consent. One more time. I would like to understand everything before I give my consent.
This one is really important, and I want our listeners to feel empowered by it. You have the right to ask questions. You have the right to understand. You have the right to say that sentence before anything happens to your body. Remember it. I would like to understand everything before I give my consent.
Let's keep going. Next chunk. What are the risks involved? What are the risks involved? Short, clean, powerful. The doctor might say there's a small risk of infection and bleeding. Now you know. What are the risks involved? Say it. What are the risks involved?
And you can also build on this chunk. You can say, what are the risks involved and how common are they? That extra part, and how common are they, helps you understand if the risk is something that happens to 1 in a million people or something that happens quite often. What are the risks involved and how common are they?
Now, let's talk about a very tricky situation. What if the doctor tells you something and you only partially understood it? Maybe you caught some words, but not all of them. What do you say?
This is where the chunk, I caught part of that, but could you repeat it, is so useful. I caught part of that, but could you repeat it? It's honest, it's natural, and it tells the doctor you were listening, you just need another chance. I caught part of that, but could you repeat it? Again, I caught part of that, but could you repeat it?
Hmm. Another very natural option is to say, I want to make sure I understood correctly. I want to make sure I understood correctly. And then you repeat back what you think you heard. For example, I want to make sure I understood correctly. You're saying I need surgery tomorrow morning? This technique in communication is called clarifying by paraphrasing. You say back what you think you heard so the other person can confirm or correct you. I want to make sure I understood correctly.
Let's move into some important medical vocabulary that you'll hear very often in hospitals. The first word is diagnosis. A diagnosis is the doctor's conclusion about what illness or condition you have. The doctor gave me a diagnosis of appendicitis. Diagnosis. Say it. Diagnosis.
The second word is anesthesia. Anesthesia is medicine that makes you feel no pain during surgery or procedure. There are two main types. General anesthesia puts you completely to sleep. Local anesthesia numbs only one part of your body. Anesthesia. Say it. Anesthesia.
And the sentence to use here is, will I be under general or local anesthesia? Will I be under general or local anesthesia? This question is important because it affects how long you'll recover, whether you can drive afterward, whether you can eat before the procedure, and much more. Will I be under general or local anesthesia? One more time. Will I be under general or local anesthesia? Good. Now here's another chunk you absolutely need. Is this procedure urgent or do I have time to consider my options? Is this procedure urgent or do I have time to consider my options? Sometimes doctors present something as if you must decide immediately, but often you have time. Asking this question gives you breathing room and information. Is this procedure urgent or do I have time to consider my options?
Wonderful. And the follow-up to that is, what happens if I choose not to have this procedure? What happens if I choose not to have this procedure? You have every right to ask this. A good doctor will explain what the consequences of not acting are so that you can make an informed decision. What happens if I choose not to have this procedure?
These sentences together form what we call an informed decision toolkit. When you use them, you are not being difficult. You are being a responsible, informed patient. And doctors, good doctors, respect patients who ask these questions.
Now, let us talk about describing symptoms, because before the doctor recommends any procedure, they need to understand what you are feeling. And describing pain or symptoms in English is something that trips up so many learners.
Let us start with the classic question the doctor will ask. On a scale of 1 to 10, how would you rate your pain? Your answer needs to be specific. Instead of just saying a 7, you can add more detail. You can say, I would rate it about a 7. It's a dull, constant ache with sharp bursts when I move.
Let's look at pain vocabulary. Dull ache means a low, steady pain that is not sharp. Dull ache. Sharp pain means a sudden, intense stabbing feeling. Sharp pain. Throbbing means the pain comes in waves or pulses, often in sync with your heartbeat. Throbbing. Burning sensation means it feels like heat or fire in that area. Burning sensation.
So a full sentence might be, I have a throbbing pain on the right side of my head, and I also feel a burning sensation behind my eyes. See how specific and clear that is? A throbbing pain, a burning sensation. The doctor immediately has a much clearer picture. Say it. I have a throbbing pain on the right side of my head and a burning sensation behind my eyes.
Let's keep building your hospital vocabulary. The word prognosis is one you need to know. A prognosis is the doctor's prediction about how your condition will develop. Will you get better? How quickly? A prognosis is the outlook for your recovery. Prognosis. Say it. Prognosis.
And the sentence is, what is the prognosis if I have this procedure? What is the prognosis if I have this procedure? Compare that with the earlier chunk about what happens if you do not have the procedure. Together, these two questions give you the full picture. What is the prognosis if I have this procedure?
Oh, let's also talk about asking for written information. When you're stressed, your memory is not perfect. You might understand everything the doctor says in that moment and then walk out and forget half of it. So a very useful sentence is, could I have that information in writing, please? Could I have that information in writing, please? Most hospitals have printed information sheets or can write a summary. Could I have that information in writing, please? Say it again. Could I have that information in writing, please?
And you can go further. Could you write down the name of the procedure for me? Could you write down the name of the procedure for me? This is especially useful when a procedure has a long medical name. You can then look it up, translate it, or share it with someone who can help you understand. Could you write down the name of the procedure for me?
Now, let's put this all together with a mini scenario. You've just arrived at a hospital abroad. The doctor comes in and says quickly, you have a perforated ulcer and we need to perform an emergency laparotomy under general anesthesia tonight.
Pause. What do? You take a breath and you say, could you explain that in simpler terms, please?
The doctor says, your stomach has a hole in it. We need to do surgery tonight to fix it. You'll be completely asleep.
And you say, I want to make sure I understood correctly. You're saying I need emergency surgery tonight because of a hole in my stomach. Is that right?
The doctor says, yes. And then you say, what are the risks involved and how common are they?
And you say, I would like to understand everything before I give my consent.
And finally, could I have that information in writing before I sign anything?
Did you notice how calm and in control that conversation felt? Even in an emergency situation, those phrases gave you clarity, gave you power, and gave you time to understand. That's what Next Level English does for you.
Let's do a final review of everything we learned today. The key chunk was, could you explain that in simpler terms, please? Could you explain that in simpler terms, please?
The sentence for understanding procedures was, can you walk me through the procedure step by step? Can you walk me through the procedure step by step?
For giving consent, I would like to understand everything before I give my consent. I would like to understand everything before I give my consent.
For understanding urgency, is this procedure urgent or do I have time to consider my options? Is this procedure urgent or do I have time to consider my options?
For clarifying what you heard, I want to make sure I understood correctly. I want to make sure I understood correctly.
For getting written information, could I have that information in writing, please? Could I have that information in writing, please?
And key vocabulary today included procedure, consent, diagnosis, anesthesia, prognosis. And pain vocabulary included dull ache, sharp pain,
throbbing, and burning sensation. Repeat those with me. Procedure, consent, diagnosis, anesthesia, prognosis.
Tom, I feel like I just took a real English survival course.
That's exactly what this was. And the beautiful thing is, every single phrase we taught today is polite, natural, and used by native English speakers every single day.
And if you're someone who travels often, works abroad, or lives in a country where English is the main language of medicine, please save this episode. Share it, because these phrases are not just English lessons. They're tools that will protect you when you need it most.
Thank you so much for spending this time with us on Next Level English. If today helped you, leave us a comment, share the episode, and keep practicing, because the best English is the English that works for you when it matters most.
We'll see you in the next episode. Keep going. You're doing amazing.
Take care, everyone.
Bye for now.